looking at doing the supraorbital and the auriculopedaral blocks. These are the best ones for auriculopedaral. Is works by stopping your motor functions. It's going to, you're going to try and reduce the ability to blink, so it makes the exam easier. And then the supraorbital is sensory, so that's going to take out some of the feeling in the upper eyelid. So the two landmarks are in the supraorbital fossa. You make a rough triangle at each, from the medial and lateral campus. You go to the top, and then you'll find the fossa in a little divot here, and then the other one we're looking at is auriculopalpebral, and that runs over top of the zygomatic arch, so then you feel like a little bundle here, and that's another landmark for you. So place our needle here and here. Roughly putting in the middle of half and middle. Thank you. Bundle, auriculopalpebral. Makes it really easier if you pinch the skin over it. Done.
Eyelid has been desensitized. We've just placed alkane onto the cornea to desensitize the cornea as well. The subpalpebral lavage here is a fairly thick, large trocar or stylet that's got a sharp point on the end. Okay. And then you have a small rubber foot plate, and the goal is that you want to have the rubber foot plate up close to the level of the sclera, not over the cornea, to help prevent any shifting that might lead to corneal ulcers from the SPL. Okay, and so once we feel like we've got adequate desensitization of the eyelid and the cornea, then we can place the SPL into the eyelid. Some people like to place it in the upper eyelid. Others like to put it in the lower eyelid. I usually place some lube on my fingertip to make sure that I can feel up inside the eyelid, and I always do this first to make sure that the cornea is desensitized. Here we go. Eyelid out. Okay. Okay, so you see how I take that up to the tip, okay, and then I'm quite high, just off, so you've got the orbital bone behind it, okay, and so it is quite thick, so you just want to, yeah, but I'm not sure he's quite blocked as far as his sensitivity, okay, so let's get some more alkane, please. Great. And he's still, see his ears twitching around? He's quite awake, okay? So let's give him another 0.3 determinant, please. I'm sorry. I'm sorry. There we go. All right, so you just have to make sure you are established with your poke. Don't be iffy. Make sure you feel, measure twice where you want to be in the place, and then just go for a defined step. Okay, so you want to pull that up. Okay, I'm just going to make sure the foot plate seats into place. Okay. And I always check it with my hand. Perfect. So it's nice and flat up against that eyelid. Okay, great. Save as much as you can. Good. want to just come over here and hold it over there. Okay. Good. Okay. Okay, so you want this to be tight enough that it's straight, but not pulling that eyelid up. Okay. So you can put your piece there. What you can do is, you tie it into the forelock, but I'll often just place a suture, right, through this big tube into the skin. The reason being is what happens is that tube will stay in place, as opposed to shifting the tube. It will keep it in place with the small rubber tube. Okay. And so I find it's a fine line between having too few sutures and too many. In a horse's forehead, if you place too many sutures, oftentimes they'll start rubbing the forehead, okay? And so you just have to be cognizant of that. So at this stage, the subpalpebral lavage system has been placed. We're now just suturing the lavage system into place on the forehead into 3 different areas. The reason being is oftentimes the small lavage system tube will migrate back and forth. If it becomes too loose, it can have the foot plate go down into the eye, so that's why we suture it into place. We also cover it with a larger fluid line by severing the fluid line on one side and then placing the lavage system on the inside. That allows it to be a little bit more robust and prevent it from breaking as easily. Afterwards, I like to place a little bit of super glue just on each of the tape spots to prevent the tube from sliding within the tape, because it will slide after a few days. Not everyone does this, it's just personal preference. So the reason why I put it on the tape is it just stops the little tube from sliding in there. Okay, you don't need to get a bunch on the horse's skin and that sort of stuff. Your SPL will end up finishing off to the administration port, which is here. So the administration port will go on through here, and you will end up placing your medications through this. So generally what we do is we will tape the administration port to a little plastic tape, or a little plastic applicator, and then we place that inside a little Ziploc bag. So the reason for that is it allows us to treat the eye while keeping this applicator fairly clean, not absolutely sterile, but fairly clean, and that will end up going on to the horse like so here. Yep, so this comes on here. Okay. Yep, and then this goes on here, right? Because here's your pressure port.
Yep.
Okay, so like that, and then I'll usually get a cap, and this one should go over top of that. In summary, the subpalpebral lavage system is used to treat issues or injuries in the eye, most notably the cornea. As you can see here, it's coming in this case from the upper eyelid. You can place them in the lower eyelid as well. Once it exits, you do want to solidify that small, thin lavage tubing in place. We generally do that with some light plast or elastoplast and some small sutures. We further reinforce it with fluid tubing, okay, because it is much larger gauge and it's much sturdier. And then in the case of horses that have longer mane, we will wrap it in through the mane, but in this case, the horse's mane has been bicked off, as you can see here, and so we've just sutured it in place, and then we'll end up placing this through here as well, just to keep that up tight. And so it's much better if you treat the horse through the point of the shoulder somewhere, because then they can't get away from you. And that's the whole issue or function of having the lavage system, is it allows the horse to still move its head when you're giving the medications, and you don't have to worry about trouble with getting the medications in the eye. The administration port is kept clean here inside the small Ziploc bag. You can see it is spring loaded, and we keep it covered as well with a secondary cap. And so the horse will get several medications anywhere between 4 to 6 times a day. And so we will check that thoroughly just to make sure that it's going well. Generally, we give about a half a mil of medications, anywhere between 0.2 to 0.5 mils of medication. And then we will chase that from somewhere between 1 to 2 mils of air following that, and we try to give about 5 to 10 minutes in between each medication to allow penetration of the medication into the cornea of the eye.